When you're actually at the team review, it really helps if the team does have some type of process or structure for how they're incorporating the outcome measures.
The manager has a projector and he puts it up on the wall so we can all see, and he gives us a comparison of each one that we've done over the past, maybe since they got here, so you can actually track the improvement all the way through. We discuss why we think the client is improving, why the basis 32 looks better or the LSP looks better, or if it looks worse, why that might be, so we connect the outcome measures to the recovery plan.
What the general trends in how the person's going, and it helps us to see the bigger picture and put what we're doing right now into a larger context of the person's life and where they're at in their recovery.
Is that having the SDQ there actually helps bring the adolescent's or the parent's voice into the room, and it may or may not be congruent with what the clinician's thinking, but it actually makes sure that some of their perspective comes directly into the room.
We have 3 monthly reviews of each case, and when we're looking at them, we're looking at the previous 6 months and trying to project some planning around the next 6 months. So in this way, we found outcome measures very useful to try and detail areas that we need to focus on.
So in the inpatient unit, when they rate the HONOS, the team rates it rather than individuals doing the rating. And what we find is that with a multidisciplinary team doing the rating, you get a better understanding of how the consumer's progressing.
If we discussed a rating and a difference of opinion about a rating as a possible problem with the rating, people start to get defensive. If we discussed, are there things that the whole team doesn't know about the consumer which is leading to a difference in rating, that led to very constructive discussions.
You need that good space where everyone's interested in the outcomes information and can explore it together.
But as in terms of solid evidence for someone's progress or otherwise, outcome measures provide that for you, and they consolidate your thinking or actually challenge your thinking.
People like to see that the interventions they've given may have worked, and so where the HONOS score reflects that, you can reflect back to the team that the outcome's been a good outcome for the patient.
Once they're admitted to the service, there's a discussion and there's an allocation of one item from the HONOS that best represents the reason the person is in the service and the main thing we're trying to change while the person's in the service. Because what we found before we were doing that is we actually often had a confusion where you had a consumer who, when they're older, mostly have multiple problems, different members of the team focusing on different items, which can be appropriate, but not being clear which items really had to improve for the consumer to move. What was the focus of our care?
Most of what we get is anecdotal kind of references from case managers who are saying, oh yeah, they're doing really well, or somebody says, oh yeah, they're doing really well, and that's basically it. We all nod our heads and going, yeah, they're doing really well. You kind of use it to sort of confirm your hypothesis about somebody. So people can anecdotally say that somebody's going well, and but not necessarily point to specific areas. So we use the outcome measures to actually highlight where, say in the case someone is going well, where they are going well. It might be across their ADLs, it might be improvement in compliance. We can actually see that. We know from the collected data that if you're scoring around 8 on your HONOS, then that's the general score people have when they're discharged out of the service altogether. So if you're getting people that are down that level, you're thinking about discharging them out.
The doctors now use it in their discharge summaries, and they'll reflect the admission HONOS and they'll reflect the discharge HONOS as a way of reflecting that there's been an outcome for patients. So I think it's really helped the team to work together as a team.